City.
Should I just leave it go? Or should we stop it?
20 minutes or so. Told I was gonna try and drive
Thinks we're good to go.
by that site,
Want to make sure.
discuss that again.
I did just the other day again.
But I don't have to run it.
Did you want a bunch of scribbly paper to, you can make a book and then let's just, make a movie with it.
Recording right now.
If you know what I mean.
Well, Mark said
Way in this world
get it to go when I push it in the.
with the
Okay, I just unplugged it.
I'll have to look at that now.
But we're ready to start.
You know, we had a really respectable conversation.
Very nice guy. Civil.
Yeah,
Civil
yeah.
guy.
As if it didn't
Yeah,
record.
I mean, I didn't,
Well, I guess we're gonna start.
Mm-hmm.
All right,
What you
thanks.
can do about it.
looking at this one from one direction or another.
Gotta have good minutes.
The guy always has.
I think if you got minutes, you're covered.
Presented
Yeah,
to
that's
us,
probably
into
good.
consideration, then we'll decision
No?
from there. I told him, I said, appreciate his call.
Totally agree.
Well, good luck, Mike.
Thanks, Mike. Meeting of the Morrison County Board of Commissioners will come to order. Please stand and join us in saying of the Pledge of Allegiance. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Morning, everybody.
Morning, Mr. Chair. Good morning, Mr. Chair.
Could I get approval of county board minutes?
So move.
Motion made by Commissioner
Second.
Wilson, second by Commissioner Wincher to approve the board minutes. Any discussion? All in favor?
Aye.
Opposed? Motion carried. Additions or deletions to the agenda? Gentlemen? No addition?
Make a motion to accept them as they are.
Motion made by Commissioner Jelinski,
Second.
second by Commissioner Wilson to approve the agenda. Any discussion? All in favor, say aye. Opposed? Motion carried. Next on the agenda is local pandemic declaration. Ms. Gruber?
All right, Mr. Chair, we've got a declaration for the pandemic. As you know, Mr. Chair, you, based upon authority granted to you through 12.29, you're able to declare a state of emergency and yourself as board chair, and then it needs to be addressed by the entire board as to whether or not that continues. And so the proposal that we have in front of you in the declaration would move that forward and advance that. So it does a number of different things, and I have Victoria and Brad up here. Given the current situation, they're both very involved in helping manage this situation. And so I guess I can take a minute to just kind of read what it is we're talking about. Is that?
Mr. Chair, I'd appreciate if
Okay.
we'd read the declaration.
Okay.
Very good.
And then we can kind of talk about the different components and what that means. But whereas a global COVID-19 pandemic has prompted the President of the United States to declare a national emergency and the Governor of the state of Minnesota to declare a peacetime emergency. And whereas with the authority granted under Minnesota Statute 12.29, the Morrison County Board Chair declared a local state of emergency for the COVID-19 pandemic on March 20th, 2020. And whereas in the event of the COVID-19 pandemic, Morrison County will need to maintain maximum flexibility to be able to respond quickly and effectively to emerging issues in an effort to continue to provide for the health, safety, and welfare of the residents of the county. And whereas in order to maintain that flexibility, we will need to delegate authority to the county administrator and leadership closest to the work involved in serving the public. And whereas our traditional system of authorizing non-budgeted purchases through board action on a biweekly schedule may not work very well. And whereas our traditional system of policies, rules, and procedures are necessary and appropriate during regular business operation, but are not in times of catastrophic events such as a pandemic. And whereas the county administrator and leadership closest to the work involved are already expected and held accountable for exercising wise and independent judgment over a wide variety of existing spending and policy areas. Therefore be it resolved, pursuant to Minnesota Statute 12.29 Subdivision 1, the Morrison County Board of Commissioners affirms the emergency declaration to continue and remain in effect as long as the State of Minnesota Peacetime Emergency Declaration remains in effect. Be it further resolved, during the course of this peacetime emergency, in-person meetings and/or meetings conducted under Section 13D.02 may not be practical or prudent. Meetings conducted pursuant to Minnesota Statute 13D.021 are therefore authorized. Be it further resolved, consistent with the authority granted to the County Board of Commissioners under Minnesota Statute 12.37 and Minnesota Statute 375.75, the Morrison County Board of Commissioners hereby delegates all necessary and appropriate purchasing authority to the county administrator or her designees during the COVID-19 pandemic event, with the emphasis to purchase locally in an effort to help mitigate the economic impact of the businesses in Morrison County. Be it further resolved, consistent with the authority granted to the County Board of Commissioners under Minnesota Statute 12.37 and Minnesota Statute 375.75, the Morrison County Board of Commissioners hereby delegates all necessary and appropriate discretion to assign Morrison County personnel accordingly, which may mean directing staff to work in positions different than their normal assignment to meet the general health, safety, and welfare needs of the residents of Morrison County during COVID-19 event. Be it further resolved, consistent with the authority granted to the County Board of Commissioners under Minnesota Statute 12.37 and Minnesota Statute 375.75, the Morrison County Board of Commissioners hereby delegates all necessary and appropriate discretion to suspend or modify policies, procedures, rules, regulation, contracts, labor agreements, and other operational decisions as are necessary to the county, as are deemed necessary, there's a word missing, to the county administrator or her delegates during COVID-19 pandemic.
Thank you, Deb. Gentlemen, can I get a motion and a second on this? For further
Mr. Chair, I'll
discussion?
move on it.
Motion by Commissioner Jelinski,
I'll make a second for more discussion.
second by Commissioner Wincher.
Mr. Chair, if I could just kind of in terms, just discussion-wise, what this really does is during an event like this, we have to be flexible in how we're operating. And clearly that's been illustrated by how we've operated in the last week and a half. We need to be able to respond quickly when it comes to purchasing. And every 2 weeks when you meet as a board, things that are coming up during this event may not be able to wait until then. And so that's what this kind of does, is allow that to be reasonable. You are kept in the loop of what it is we're doing, and you are very much aware of what it is we're doing, and I look to you for guidance during this whole event and the process, and will continue to do that. However, waiting for a board meeting to act officially on those is what becomes a little problematic when we need to respond so quickly. And so that kind of in summary is what this does.
If I may, Mr. Chair.
Commissioner Wincher.
We got the staff in front of us here. If there's something that really comes up, and again, by reading this here, I'm assuming that, again, I sit on other boards, that Deb would have the authority to make a decision with the staff. Am I correct? Is that how I'm reading this?
Yes.
Or giving her the authority to do that. And again, by sitting on other boards, if it's something that's really of serious note, then I believe, well, the other board or the administrators that I sit on are gonna contact the board and we can have emergency meetings. Please correct me if I'm all wrong, if it's that major of a decision.
Well, and as what's been happening, similar to what's been happening this week, I've contacted you when it's been kind of a change of course, or when there's something that's going on that really is quite impactful to either the organization and those of us that work here or the public that we serve. And so this isn't something that's meant to be you're out of the loop, because I don't want you out of the loop. I need you in the loop, and I need you to be aware of what's going on and to make sure that you're on the same page when it comes to that. But it is about flexibility from following those procedures that are normally followed with every other course of business under normal circumstances.
It gives you the authority to purchase in this time of need without board approval, is what it means.
'Cause
So we
this
don't have
is-
to have a meeting
Yeah.
to approve a budget item.
Yeah, and it's not budgeted because this is something that came up. So it's just giving that flexibility when it comes to, there are things that have already come up and may continue to come up, like technology that's needed now to be able to conduct business under parameters that exist. It could be items for staff, safety equipment if it's available, and how that needs to be distributed and for those who are responding to that, things of that nature. Yep.
And if I may, Mr. Chair, just for the record, Deb has been keeping myself, I'm sure you guys all got the emails and everything, keeping us well informed what's going on. And again, like she said, it's changing hourly, day to day, so those are things that we just don't have, we can't all get together at all the same time, so that's why, I approved this resolution.
Any other discussion?
And Mr. Chair, if I may, that's exactly what 12.29 says. It's not like it's an open book, and it certainly isn't as if the administrator does not have conversation with each and every one of the board members. Because today, with technology, we do have that conversation. But all of a sudden, 1, 2, 3, 4, or 5 of us are not available. It gives that authority to the administrator to act as needed. Thus, I fully support it.
If I could maybe give just a bit of an update on what's been happening over the last week, along with this declaration. There are currently, as of yesterday morning, 235 cases. They are still mainly to the south of us. There is one up in Cass and 1 or 2 in up near Moorhead, down in the southwestern part of the state. And as was indicated earlier, this is a pretty fluid situation. We've been meeting regularly. We mentioned last week that we opened our operations center, our department operations center, and now are opening our EOC as well, and have been meeting frequently on this, and had a meeting a couple days ago. The Public Health Department did create a tracking sheet to kind of keep an eye on who's calling, what their needs might be. And so I just checked with Emily this morning, and she's averaging about 5 calls a day regarding COVID-19 related issues that come through public health. I will also let you know that the legislature approved some emergency funding, and so it did come through to the CHB, and I'm working with Todd in Wadena County on how that should be split. So we do have some funds that have come through for staff time for public health around emergency operations and the staff time that requires. We also had a phone call with the schools yesterday, social service, public health, and the superintendent to talk about their plans for kids and how can we partner, make sure they're getting the necessary food and support. So it's very fluid at this point still. It changes daily. Fortunately, Victoria is dang near in our office now, so we see her a lot, and so that's worked out quite well at this time. But that's where we are, I think, as of today. So I don't know if Victoria wants to chat a little bit more?
Yeah. Yes, thank you. If I could just share, so along with this pandemic, meaning that it's a public health emergency, with our county structure, public health would take the lead, and then the county emergency management is supporting public health. So as Brad said, they activated their DOC, their Department of Operations, or their Department of Operations Center, and then emergency management partially activated our Emergency Operations Center. That just means that we're doing the work to help support public health along with our community. Some of the things that we're doing is making sure that we are in contact with police, fire, and EMS in terms of what types of needs they have to respond to this pandemic, in terms of personal protective equipment. If they need any kind of N95 mask, if they need surgical masks, if they need face shields, different types like that. I'm working directly with, through our channel, the state of Minnesota to reach out for if we have caches available for different types of equipment, in contact with Brad to make sure as far as with reaching out to the community in terms of their needs. And then along with this declaration, it does activate our emergency operations plan, so we can work through as far as with those specific roles that we have with our ICS structure in terms of the county administrator being our PIO and working with Brad on that, and just making sure that we've got a process in place to fill those roles so we can continue to support the community and our first responders with whatever types of needs that they have.
Gentlemen,
Sounds good.
thank you guys for everything you're doing. We appreciate it. I know it's got to be a difficult task, and it's, like Brad said, it's fluid. It's consistently and constantly changing from hour to hour, and we appreciate it very much. Anything else, gentlemen? Motion before us is to approve the local pandemic declaration. We have a motion and a second. Any further discussion? All in favor?
Aye.
Opposed? Motion carried. Thank you, Brad. Thank you, Victoria.
That wasn't a roll call.
Next on the agenda, Chelsea? Mudfest, large assembly application to be held on May 20th through the 25th, 2020. Welcome, Chelsea.
Morning, Chelsea.
This morning I have before you the large assembly application for Mudfest to be held on May 20th through May 25th. Mudfest in their application is requesting approval for a variance on Section 5, License Application Subdivision 4, E2, on fencing and barrier requirements. With this approval, I would suggest that it would be contingent upon the following: Minnesota Department of Public Health and the CDC large gathering guidelines. I would also state that it's contingent upon myself receiving and obtaining a $10,000 bond from Section 7, Additional Conditions of the License, Subdivision 1, and the Commercial General Liability Insurance Coverage in the same section of the Additional Conditions of License, Subdivision 2, by Monday, May 4th. In your packet that you have before you, we do have the revisions, and so it does state May 20th through May 25th. And then along with the safety plan requirements, there is no more option 1 or option 2. It was discussed at planning session, and it has been revised to reflect what was agreed upon at planning session for beverages being transported.
Gentlemen, could I get a motion second for further discussion?
I'll make a motion.
Motion made by Commissioner Wilson,
Second.
second by Commissioner Wincher. Any discussion?
Again, if I may, Mr. Chair, this has been approved by the Sheriff's Department, I'm assuming?
Yes.
Yep.
All right. No further questions from me.
Any other discussion? Hearing none, all in favor? Oh,
Can I just make one
sure.
comment? The insurance date is problematic. Ralph's not able to get that insurance until about a week beforehand, and so the March 4th date is gonna be problematic, and he's gonna endeavor to get it as soon as he can, but that's been an issue in past years too, and we just wanna clarify that, you know. It's about a week to 10 days, is it not?
The insurance company will not send a certificate out until 7 days prior to the event. It's just, that's the way Lloyd's of London do it. They just don't, so we can pay for it and all
Would
that
you be okay,
prior.
Chelsea, if we had on there by 7 days prior to the event? Or does that screw something up for you?
I am fine with that if that's what you choose, yep.
By 7 days prior, you said, correct?
Yes.
Okay, gentlemen, you okay with that? So the last, your last bullet point, instead of by Monday, May 4th, it should say by 7 days prior to the event.
Correct.
So, Mr. Chair,
Yes, Commissioner.
if I may, Chelsea, what is the purpose of doing it your way versus doing it Mudfest's way? Just having it earlier, just having your ducks in order sooner? I'm just asking.
Normally, I receive the bond and application, or the bond and insurance. I requested to have it as soon as possible, and I know that the insurance companies and normally don't get that to me that quickly. I know that normally it's within the same month of the event, so I was just looking at timelines, but I am totally fine with the 1 week prior to the event.
Okay.
Yep.
Very good, thank you.
Just as long as we're not, 3 days before the
Yep.
event. So I'm fine with 1 week.
Clear,
I know.
very good, thank
I
you.
did it on purpose.
All right. Any other further discussion, gentlemen? All in favor of that motion to approve this with the followings, with the contingent upon the Minnesota Department of Public Health and Centers for Disease Control and Prevention large gathering guidelines, and obtaining a 10,000 bond and commercial liability insurance covering 1.5 million to be received by Chelsea 7 days prior to the event. All in favor?
Aye.
Opposed? Motion carried. Thank you, Chelsea.
Thank you.
Thank you, Chelsea.
Thank you, guys.
Gentlemen, thank you. Good luck.
Next on the agenda.
Next on the agenda, county board warrants.
I have a request to approve the county board warrants to pay the bills.
Mr. Chair, I'll move on.
Motion made by Commissioner Blaine,
Second?
second by Commissioner Wilson to approve the bills. All in favor?
Roll call.
Roll call. Commissioner Wincher,
Aye.
Commissioner Blaine, oop. Commissioner Jelinski,
Why is this not an order?
Commissioner Wilson,
Aye.
and myself, aye. Sorry, guys.
You did that.
Motion carried. I couldn't
I
have
must
done that
have
on
do
purpose.
send out two different reminders.
And then last but not least, I have the cash report in this packet as well. So you will see in this packet, February's cash report for the month that you receive monthly. So February was a good month as far as cash flow coming through, so
Thank you, Chelsea.
Thank you.
Excellent. Thank you.
Thanks, Chelsea.
Appreciate it, Chelsea.
have a good day.
Sorry, gentlemen, I have the wrong version up here. Sorry, I just realized that.
Next on the agenda, Sheriff's Report. Sheriff? Good morning, sir.
Morning, Sheriff.
Sheriff. Tom, thank you for working with MudFest and getting it all straightened out ahead of time.
Absolutely.
I appreciate that.
So, obviously, we're changing the way we do business just like everyone else. And I'm gonna just breeze through this because we have meetings with our own staff, working on different directives. As I've heard you guys and the public say, it's changing hourly. So we'll go through this report fairly quick. You'll see training, we had 17 officers attend SFST, which is Standard Field Sobriety Testing. And this again's for the month of February. So anybody that works TZD shifts towards zero deaths, it's a requirement that we have this training. In February, I know it says no presentations, but I did one for the Lions Club. It was a Little Falls Lions Club. We did a drug presentation, kind of talked about the operations of the sheriff's office. That's pretty much it for that. Our complaints, you'll see, we had 74 criminal complaints. Really, our theft was the largest, and 6 of those 14 were from gas drive-offs. Going through our citations, you'll see our verbal warnings, 87, and then we had 8 speed citations with 7 written warnings. 2-year comparisons, pretty comparable to where we were last year, except for the exception would be our inmates, and you can see our count is down there. Total inmates, we averaged 34 for the month of February. You can see we didn't have any inmates that we housed from out of county, leaving our average at 34. Out of county inmates, again, number of inmates held is 0, so we had 0 revenue coming in. So with COVID-19 being the big factor here, I don't see that changing until we can get through this. And once we do, hopefully those numbers are changed. So the way we're doing business has changed, obviously. The way we're trying to do more phone interaction versus face-to-face. In our jail, we have some different protocols in place. We're screening inmates before they actually come into our facility, checking their temps. Practicing CDC, or adhering to CDC guidelines, practicing our social distancing. And everything, we're trying to keep the business flow as normal. I can tell you gun permits, things like that, there's some offices that just said, hey, we're just gonna shut down. We're gonna sit back and just shut down. We're not gonna do that. We're gonna make appointments, and we're still gonna work with people and make sure we're responding to their needs. So with that, any questions?
Gentlemen?
Again, Sheriff, I just appreciate, again, the people that you talk to, appreciate what you guys are going through these past week, month, or whatever. And I can just see the challenges you have in your deputy sheriffs. You know, if you have somebody that you get a house call, or you think that they may have the virus. I just, again, appreciate everything the sheriff's department does. And again, I hope the rest of the community does that as well.
Appreciate that.
Same here.
Sheriff, do you have the PPEs you need?
We do.
For you
I can
guys?
tell you that I've been working with our ER, or our EM manager, Victoria, with that. We have limited amount, so we're working on getting some more. And kudos to her, she's been reaching out to our first responders as well, making sure that everybody's got what they need in the county. And it's been good. We've been working together, I think, as a county, and we need that. I can tell you, moving forward, I'm thinking the way we need to do business. I'm so used to doing staff meetings where everybody's in front of me, working with IT, trying to figure out how we can do conference calls and just really stay in the loop and making sure our staff is taking care of themselves and their family and, of course, the community. So the only way to do that is interaction. And I'd rather have some type of communication versus email, so now we're
Yes.
going to these conference calls as
Very
well.
good idea, yeah.
And Mr. Chair, I just want to say thanks to Sean and Brad and Victoria and all the leadership that's been working together. Sean's right. Just trying to figure out what do we do with the building? How do we still serve? I mean, Sean and his staff grounds me every day about we can't just close our doors and we can't just send everybody home because of the work we do. We have to be here, and that's what our job is. And so having those discussions and knowing that we're all part of a team trying to work for the greater good, yet under stressful conditions, has been nice. And I think that's what's getting us all through it. So I do appreciate that, because not everybody has that, and I think Morrison County does, and that makes us one step ahead.
Mr. Chair, if I may, Sheriff, and I don't know if that you're aware of this, but I was involved in an emergency phone conference last night, and probably we'll have another one today or tomorrow with the EMS Joint Powers Board regarding disinfecting of ambulances, disinfecting of squad cars. There's evidently a special tool out there with a special solution, and I can't tell you anything about it because I know nothing about it, that the Central Region EMS Joint Powers Board is strongly looking at to purchase a good number of them, quite expensive, and have them within the region. I'm confident we'd have one here. It probably would be at Gold Cross. I don't know what it is, but it would also be in conversation, something that a squad car certainly would be able to use also. Again, more to come because I don't know enough about it yet.
So what I do is I get my emails from the MSA. Of course, they give direction and advice.
MSA stands for?
Minnesota Sheriff's Association. So I just handed those emails to Victoria, and part of that is reaching out to our regional people, like you were stating. So, but yeah, I think it's just the new world. We're trying to sanitize everything we touch, including squad cars, electronics, and keeping our environment safe. The biggest thing is keeping our staff safe. As everyone knows, we're all essential employees with our correctional officers, our dispatchers, our deputies, and, you know, everybody's healthy, so that's great, but I can tell you if one or two people go down, we're gonna be hurt, because we hurt now if someone calls in sick, so we're gonna try and keep everyone safe and healthy.
Very
Mr. Chair,
good.
I'd
Yes.
just like to say thank you too, and I really appreciate the fact that you guys have all been making the public aware of what we're doing. I think that's very important because they're out there scared too, you know, and it's nice when you go on the radio and you inform them what's happening and where they can go for things, because they just have questions and want to know things. So I appreciate the fact that you guys are doing that.
Thank you.
Thank you so much, Sheriff.
All right, thank
Tell
you.
you guys
Thank you,
thanks
Sheriff.
from all of us.
We'll do that, thank you.
Thanks, Sheriff. Have a good day.
Thanks, you guys too.
Public Health Social Services Report. Brad?
Yes, I'm gonna ask Carmen to come up here. And Cindy and Sarah to come up as well. But Carmen is here to read a proclamation for Public Health Week, which is the first full week in April. And of course, we have a lot going on with public health at this point. But I'm going to have her read this proclamation and ask for approval.
Good morning.
Good morning.
Morning.
Proclamation for Annual Public Health Week 2020. Whereas the mission of Morrison County Public Health is to enhance the health and well-being of all Morrison County residents and communities by providing quality service that promote healthy behaviors, prevent disease, protect from harm, and assure access to quality health services in collaboration with community partners. And whereas the vision of Morrison County Public Health is to assure that every individual has the opportunity to achieve and maintain an optimal level of health and independence and to lead a vital, productive life. And whereas the Morrison County Board of Commissioners are working toward a community whose citizens reflect physical, emotional, psychological, and social well-being. And whereas the many programs provided by Morrison County Public Health benefit all county residents, whether directly or indirectly, and these programs are essential ingredients of a healthy population. And whereas the Morrison County Public Health Department must continue to reach out to those in the community who seek assistance, and whereas the Morrison County Public Health Department must continue to promote community health and educate residents of the benefits of a healthy lifestyle, and whereas Morrison County Public Health declares to continue to identify local public health priorities and implement to address the areas of public health responsibility, which include assuring an adequate local public health infrastructure, promoting healthy communities and healthy behaviors, preventing the spread of communicable diseases, protecting against environmental health hazards, preparing and responding to emergencies, and assuring health services. Therefore, be it resolved that Morrison County and the Board of Commissioners does hereby proclaim the first full week of April annually as Public Health Week. Thank you.
Gentlemen, could I get a motion and a second?
Thank you, Carmen.
I'll make a motion.
Motion made by Commissioner Wilson,
Second.
second by Commissioner Jelinski to a proclamation to approve annual Public Health Week for 2020. Any discussion?
Could I just make a couple comments,
Yes.
Mr. Chair, if I may? So,
Please do.
as we know, we try to do a few things both with our staff across the government center during Public Health Week, as well as get on the radio and talk about the overall health of our community and what public health does. So this year, well, we're gonna be a little bit more flexible with that, because I think we have a few other things happening, but we still want to recognize the hard work of our public health staff in all of the 6 areas of work that they do. And I know we were on a call yesterday with the schools, with Sarah and Carmen, talking about what can we do around the overall health while these kids are homeschooled for the rest of the school year. So I will say that public health has tried to really be creative on how we can still support our kids in trying to make healthy decisions, healthy choices, eat healthy, and work through some of the other issues around our community health needs assessment. But as we know, it seems like our focus is going to be on COVID-19, but we don't want to necessarily forget about the other aspects of public health. So thank you, Carmen.
Mr. Chair, we're going to pass up the picture today, so I got one of Carmen presenting.
Carmen will be on our Facebook
Beautiful,
page
yes.
showing.
Thank you so much, Carmen.
I do.
And Mr. Chair, I don't know that if we've all heard of public health in the past over and over and over, but in this time, or at this time, with what's going on, I think that we all wrap our arms around public health just a little bit more than ever. So thank you very much.
Lucky to have you and
Absolutely.
all your people helping us out at this time. And I like that you're reaching out to the schools and helping out with the kids. That's awesome.
Fantastic.
Thank you.
We have a motion and a second. Any further discussion? All in favor?
Aye.
Opposed? Motion carried.
Thank you, Mr. Chair. I'm
Thank
going to
you,
have
Carmen.
Cindy and Sarah sit up here, and I'm just going to sit back here. There. So I'm going to pick and choose a little bit some of the reports that we're going to provide, given kind of the conversations around COVID-19, and I know that the board did not have a lot of stuff on the packet today. So, but MnChoices is one of those critical and essential areas to ensure our most needy get services and support, both to hopefully keep them out of nursing homes, but as well as maintain them in their own homes, whether it be children or adults. So I asked Cindy and Sarah to put together a PowerPoint on MnChoices. So I'll turn it over to them for now.
Welcome, Sarah.
Good morning,
Good morning.
Board.
Good morning.
Good morning. So this PowerPoint was done before everything happened with COVID-19, so bear with us as we may add a few things here and there. But so what is a MnChoices assessment? Basically, it's a person-centered assessment to help people with long-term chronic needs make decisions, keep them in their homes, right? We want people to remain in their homes, in their communities. So MnChoices addresses their needs and how we can hopefully do that. It really is an assessment that's above and beyond what typical medical assistance services can provide for them, with the exception of developmental disability case management and personal care assistance services. So the next slide shows what an assessment is screening for. What are the types of services that they're eligible for? And so developmental disability case management, developmental disability waiver, all of our waiver programs, CADI, CAC, BI, EW, personal care assistance, consumer support grant, just all of these different areas that are for our high needs clients. So the next slide shows our MinChoices assessments per month since January of 2019, and we combined it for social services and public health. So what this shows us is that we continue to see an increase in MinChoices assessments. We do typically about 10 to 12 per month per assessor, which I'll get to a little bit in the next slide. We continue to have a lot of people on the waiver programs and on these kind of services, which means they need an annual assessment so that they can receive the same services next year. So we do a lot of annual assessments, but we do a lot of assessments that are new, people just coming on, wanting and needing extra services. So social services has three full-time assessors, and their caseload is a combination of new and reassessments, and the average is about 10 to 12 a month. Based on the numbers I just showed you in the last slide, we're averaging close to 12 per assessor per month. So a social services assessor holds on to cases until all their waiver eligibility is determined. Most often, waiver eligibility means they have to be eligible for medical assistance, they have to be certified disabled for certain programs. And so the assessor's job is to ensure that they meet all those requirements, as well as they help that person and family determine which program would best meet their needs. Public health has one full-time assessor, and all their public health case managers are also certified as assessors. And so they do have, some of them will do reassessments, but mostly one full-time MinChoices assessor. The next slide shows our revenue, which, as you can see, has increased from 2017 to 2018 to 2019, which we expected with the increase in MinChoices assessments. So we're right on track with what we budgeted for this year, and we're looking very well, very, very good in that area. With COVID-19, we were waiting on direction from the state on what that's needed to look like, because obviously our assessments are face-to-face. And so just recently this week, they said that we could do those by phone or video. So we are going to continue to do it that way, and continue to do reassessments and assessments as best as we can to make sure people are still receiving the services that they need and being mindful of what their health and safety risk is. So,
if I could maybe just make one comment, Cindy, about that before you move to the next slide, and that is that we actually had one of our staff inventorying all of our providers, both from a social service and public health standpoint, to see who's providing services, who's going into the home, because this is a critical need for some of the individuals who are on the waivers, who are getting child protection services, who are getting nurse-family partnership services. And so, because to some degree, may have to prioritize who gets services through our MinChoice assessments, just because of the provider shortage and them choosing maybe not to go into the home. So we have one staff continuing to track all of our providers, who's providing services, who's doing them remotely or through technology, and who's willing to go into the home. Because some of these folks actually do need people to come into the home and provide supports and services. So, but I thought I would, since Sarah was talking a little bit about the services, I would mention that.
So the updates and changes, right now MinChoices is in the process of a new build, so they're going to 2.0. The rollout date keeps changing, so I won't even make a prediction on that. And now with everything that's happening, it's probably even further back. But they are trying to reduce the amount of time spent on a MinChoices, because that's been a statewide complaint that face-to-face assessment takes too much time. They have started by selecting a vendor They've got it narrowed down to 3, I believe, and by August, they'll know for sure who the vendor is and then start the build. They have also started gathering some information across the state about what we want to see in Min Choices. So we're hoping that the new product, when it rolls out, will be better. You wanted to talk about the audit?
Every 3 years, the state does a Min Choices waiver audit, and are due for that audit in 2021. Well, we'll see what that looks like now. But that occurs every 3 years, scheduled for 2021, and they can pull a random sample of cases, and so they pull them all the way back from a year prior to the audit. So they would start pulling cases this summer. They could start pulling our summer cases to work on this audit. So they can pull around 30 cases, and they review about 56 items in each of those case files to see if we're meeting requirements. So more to come if that's going to continue.
So when someone is certified as a Min Choices assessor, the process is actually about 30 hours of initial training, watching videos and doing practice assessments. Then we also send them out into the field with a certified assessor to do some side-by-side assessments. So it's really a pretty lengthy process. Every 3 years, they have to recertify by having 45 continuing learning units. So the different educational offerings, 12 of which have to be person-centered. So it's a pretty in-depth process to maintain that certification. Last fall, they started monitoring to make sure that not only was everybody meeting the requirements, but were we making sure that we didn't have any lapsed assessors. So they will actually pull a sample of assessments and compare that to the known list of people that have kept up their certification. So a county can't let someone continue to do assessments if their certification has lapsed. So we have an internal system where we're monitoring who's due for their recertification and when, and making sure that we aren't sending an assessor out who has let their certification lapse. And so we're not having any issues with that. Everybody's really paying close attention to it. One of the other things that's happening is that they're trying to do some continuous improvement. So internally, the state is able to track how many people are assessed, the number of times an assessment process exceeded 60 days. So when we get that call to do an assessment, we have 20 days to go out and complete that face-to-face or currently via phone or video assessment. And then we still have 60 days to try and get that assessment services in place if they indeed qualified. So they can track that based on when we do the assessment and when the services are actually input into the system. They're also keeping track internally about the number of people that get multiple assessments in a year. Because someone has a change of condition, they have a right to request a new assessment, or their medical or living situation changes dramatically. We need to go out and reassess them. They're also keeping track of the amount of time spent waiting for financial eligibility. And across the state, that tends to be the biggest road bump, not just because the assessor, the financial workers are busy, but it takes a long time for people to gather their data, get their application in, get their proofs in, get a letter saying they're missing one item or whatever that might be. So that's a major bump. A thing that they're doing differently starting now here in March is that every time an assessor completes an assessment, there's actually a new field on the assessment screen that has them enter the number of minutes that they spent face-to-face with that person. So the state's able to see that. It's not us just anecdotally reporting we spend 3 hours at an assessment. The assessor literally puts down the time face-to-face. However, they're not tracking the amount of time we spent preparing for the assessment, the amount of time we spent completing the paperwork afterwards, the drive time, et cetera. They're only tracking the face-to-face time right now. But that's a start. And then as Sarah mentioned, the executive order from the governor on Friday allows us now to do our face-to-face assessments via phone or video as the client's needs require. So we're adapting as well as we can. Our goal is to not turn people away. We are kind of trying to screen. We know that sometimes we'll do an assessment, and given the current environment, there may not be any agency willing to open a new case for the services that that person's asking for. So we will do an assessment, and they may have to be on hold through no fault of their own or our own. We're trying to triage and really figure out the best way to move forward with this work.
Gentlemen?
Mr. Chair, I have at least one question, and I think for Sarah. You said that the regulations were lifted, if you will, as far as face-to-face was concerned, that you could do a whole bunch of this via phone. My anticipation is that there's someone somewhere that still requires face-to-face. Don't know if I'm right or not, but if there is, are you folks in your toolbox, do you have PPEs and such to be able to get that done safely?
At this time, we do not.
Okay.
Very limited. We have a few masks.
Okay.
And we are preparing staff to make good hygiene decisions as they have to do these visits, and we still do have some social workers who are doing face-to-face visits. We're gonna be expected to do with child protection, vulnerable adult. And so, we are paying attention to that to make sure we're protecting our staff.
Okay.
And Mr. Chair, Cindy, can I ask a quick question? Those assessments aren't a physical exam. It's
And they
a,
never were.
they
It's an
never were, so
interview.
it's one of those where, I don't know if that was understood or not, where it's a,
The distance is more than anything.
exactly, where
Yep.
we may have to have it look different
Yes.
in terms
Yep.
of how that, or like the setup maybe.
So, yeah, we are able to maintain social distance because we don't have to take blood pressure,
Yeah.
do any of
And-
those physical.
yeah, I'm
And they're
kind of
calling
aware of that.
ahead, making sure that everyone in the house is healthy. We do still have the option, if that person is physically able and willing, they could come in here to the office. We would certainly sanitize the room after they left. If maybe there was somebody at the house that was sick, but the person needing the assessment was willing and able to come here, we would certainly accommodate that any way that we could.
It's somewhat a case-by-case basis at
Very
this
good.
point.
Thank you.
And I think, Mr. Chair, it's important to remember, and this is something Brad and I have talked a lot about, and I know you have too, that we serve people who need help, and we can't let them down, and I think we need to pay attention to that, and I think staff is aware of that, and as leadership, we're continuing to remind people that if we're not here, there is no one. And so I really do encourage staff to keep that in mind, and as leaders to remind people that this is our basic core mission, is to help folks that need help and to determine what it is they need and to make sure that we're doing our best to make that happen. So I think that's important.
I think the other thing to bear in mind as this unfolds, I heard Public Health Director from Otter Tail this morning on NPR, and she said we need to remember that what we're dealing with here is probably a marathon and not a sprint. And so we need to be thinking about this as a long-term kind of situation that we could be in, and how are we going to keep things rolling. And our folks that are in their homes, if a home care agency that came every day or every week and filled their pill box can no longer come because all of their staff went down sick, we may be called upon in some of those situations to plug a hole and fill a gap. We don't know what that looks like, and we need to continue to roll with that.
Very good. Anything else, gentlemen?
Mr. Chair, Brad, I got a question, I think, for you. With all the people being laid off and everything now, how do people know if they qualify to get help? Well, how do people know? And a lot of people have never been laid off before, and a lot of them are in that stage now. So what's kind of the steps that go? I don't know if that totally pertains to you.
No, it fits with the work that we do.
Yeah, so.
It all fits together, definitely all fits together. And so we did put resources out on our website as well as on Facebook, how they could apply online. Their first step is going to be to apply for unemployment insurance if they got laid off. And through the executive order, I think they're immediately eligible for unemployment insurance. Once they do that, they can apply on MN Apply or MNsure, both for either food support or health care. And then we have our applications out there online. And if we need to do a face-to-face or support somebody, we will do that. But most of that can be done online and through telephone.
And what's the online, is it Minnesota?
Apply MN is where they would go out and apply.
And then, Mr. Chair, it
Apply
directs back to
NMN.com.
where they're residing. So then employees here get that and then follow up and do their work.
Yep, so then that comes through us through a SIR email. We will follow up with that application, ensure the information is accurate, and then make a determination about eligibility. So the phone calls haven't picked up a lot yet on the financial assistance side. But I know some things are coming through. It's probably impacted more so the child support unit right now. They're getting a lot of hits on the unemployment insurance. So,
Okay, thank you.
Very good.
One of the things that we did learn that's causing some angst for some of our seniors is that senior linkage line had mostly retired volunteers that went out and helped people fill out medical assistance applications, and they no longer are sending those folks out. So that is becoming a bit of a struggle with people that can't figure out how to fill out that application. So that may be a place where we typically didn't do that work, but we may need to so that someone's MA doesn't lapse or that they can get eligible.
If I may, Mr. Chair, you bring up MA, Cindy, that if I'm on MA, and again, help me out here, do I have to reapply every year, or is that why people, you know, if you have seniors that are applying for it, if they're already receiving it, but they have to apply like every 6 months?
They have to do re-eligibility updates to continue to prove where their income and assets are at.
How often is that?
It depends on their situation. Most of them are annual, but some are semi-annual depending
Okay,
on their
that makes
income
sense.
and.
I was just gonna say, however, they have, those that are up for renewal, April and May do not have to do anything. So through the governor's executive order, anybody who has renewals in April or May will not be, we will not close anybody on MA that has not completed the renewal information. So,
But again, you may, again, they're kicking the can, which I understand that, so April, May, now come June around, you'll have those people from April and May having to need the assistance, plus the people in June, yeah. it's,
There's a potential bottleneck, and so we're trying to process what we can, but no one will be punished for not getting a renewal in right now.
and I expect our, you know, individuals are, especially who have been on for a while, are accustomed to that. So if they put their stuff in for the renewal, we'll take care of it. But we don't want to penalize people who aren't able to access information, whether it be banks or other things, so.
And when we talk about waiver eligibility, I'm by far not an expert in the financial world, but straight medical assistance eligibility and long-term care eligibility for a waiver are two different things. So you might be on straight medical assistance, but you still need to apply for long-term care eligibility. So that's where the application process and eligibility determination comes in.
Mr. Chair?
Yes.
Brad, I know we probably don't have enough help in a department to handle what's coming or whatever. Is there people in the courthouse that do other things that possibly can help with that? Or is that a whole training?
Mr. Chair, there's so much unknown right now that those are questions that spin in my head and are spinning in Brad's head and everybody else who is charged with managing staff right now. There are some people who have not the same level of work because nobody's walking through the door. And there are people that are busy as ever because they have to manage different components that have increased because of it. And that's what makes this tough right now. But yes, those are thoughts we've had, and in terms of what we do now is going to impact what happens in the future. So preparing for that is important. So I think there's work that's done that's going to be, okay, what are we going to do when the switch does get turned on and this backlog is coming to our door? What are we going to do to manage those questions that come in, and how are we going to do that? So a lot of planning, a lot of thought process, and a lot of unknown, which makes it really hard.
You know, and I think there's two things, Commissioner, and that is, number one, what increased traffic will we have given our current economy, which we've not seen yet. We're not sure what that's going to look like. But then I think also we continue to talk about, even though DHS is pushing things down the road, how can we still mitigate some of these things so that we don't have everybody coming in June, or if they push it out to July? We don't want to stop everything because we can. We want to make sure people get the services, want to make sure people remain eligible, but if we can accomplish some things and people are willing to do their renewals, we want to pay attention to that, because not only could we have the funnel at the end, but then we could have an increase in our applications and things like that. So we're talking about that continually, and monitoring our phone calls, our applications, and it's important that we make sure we have people that are able to do the work. It becomes more challenging to pull somebody from a public health nurse to determine eligibility for financial or health care because of the requirements of our training and access to our system. So it's not just as easy as pulling somebody from another department or another position, but we will definitely pay attention to that.
And it is, the longer this goes, the more, I think, I don't know if Cindy or Sarah said it too, that we need staff working on how it is we can reach out and what it is we can do to think through how we do our work and really get to the people that need to have that service, and think differently. And so it's not just, go home and continue to process what's coming in. It's actively engaged in how can we seek this out so that very thing doesn't happen. So there's not a backlog, and so people aren't sitting in their homes and don't have what it is they need. And so I think that's one thing too that we need to keep in mind, and that staff needs to remember, that is we're going to be tasked with a little bit different kind of work right now, which is figuring out how to do what it is we have to do. And so a lot going on.
Yeah, there's people isolating, but the nice part is in January, so people are getting out a little bit, and it's okay to get out of your house. So if it was January and the isolation that would be happening would be very concerning. Still worried about it, want to pay attention to it, but I think people still want to get out of their house when the sun's out and the weather's a little bit warmer, so.
Thank
Very
you.
good.
for all you
Thank
do.
you so much, Sarah and Cindy.
Thank you very
Thank
much.
Thank you.
Good job, thanks.
Thank you guys a lot.
I have one other public health item, and it's a new annual mobile food license for Backdraft Barbecue on Shoreline Drive, and this is actually, they're doing a annual one now versus they used to get some temporary license. Now they're doing an annual so they can go anywhere they want, anytime they want, so.
Read the motion, please.
I'll make a motion.
I'll second
Motion
it.
made by Commissioner Winter, second by Commissioner Jelinski to approve the new mobile food unit license. Any discussion? All in favor?
Aye.
Opposed? Motion carried.
Thank you, that's all I have.
Thank you so much, Brad.
Thanks, Brad.
County Assessor will discuss property values and trends. Morning.
Morning.
Good morning.
Good morning.
Morning, ladies.
Good luck.
Good morning. From Land Services, we have two items. The first one is to have Jean visit with you about where we're at with property valuation. This week, the tax statements and valuation notices will go out. So we wanted to brief you on that before they go out so you have an idea of what's going on. So go ahead, Jean.
Good morning. I'm
Morning, Jean.
just going to start out with a brief review for you. I review all the sales in the county from October 1st, 2018 through September 30th of 2019. And that is for the 2020 assessment payable in 21. The sales are categorized first by the city and township and then by classification, so such as residential and seasonal, agricultural, commercial, industrial, and apartments. I'm supposed to be at 100% of the market. The Department of Revenue does allow me to be between 90 and 105. And so if I'm under 90, then I need to increase values. If I'm over 105, I need to decrease values. These numbers do include finance adjustments and trends. And some of the areas, they because they're small, they don't have more than 6 sales to show a market. So those we will look at a 5-year study. The market in Morrison County has been extremely strong. And so I'm not going to note any changes that were 5%. But the residential and seasonal, the percentage only applies to the building and not the total value. Bellevue Township went up 7%, Buckman Township 10%, Boo Township up 10%, Caldrum Township 8%, Darling Township 10%, Lakin Township 7%, Pike Creek is down 7%. Platte Township is up 6, Ripley Township is up 13, Swan River is up 10, Swanville Township up 8, Two Rivers Township up 12, Genola up 8, Harding up 10, Lastrup up 9, Motley City up 11, Pierce Township or Pierce City is up 9, and then Little Falls Township is anywhere between 5 and 10%, depending upon the area. Agricultural land and rural preserve has increased by 5% in Swanville Township, Elmdale Township, Two Rivers Township, Bellevue Township, Buckman Township, Mount Morris Township, and Scandia Valley. Most of those are sitting on that south border of Morrison County, and the values have been increasing quite substantially lately. So, commercial buildings, the only commercial change that I've done is reduce Pierce City by 5%. I do have a couple other items that I want to discuss briefly, but any questions on those?
And if you'd like that in paper format, we can certainly email that to you so you have it in front of you if you get calls and all that, just to kind of, zero in on your areas and kind of what you need to be aware of, so.
That would be nice. Mr. Chair?
Probably a good idea.
I have a
Commissioner
question.
Zelinski.
Jean, without pretending that I didn't understand what you said, the 10%, the 6%, the 13%, and the 10% that I have written down up, we're talking about sales of homes here, are we not?
Correct.
Yeah, it's market driven.
Yes.
Exactly.
Yes, and it's those percentages are on the building only, not on the land. And that's on, not on the total value. So a total value is gonna bring that 7% is gonna be up higher on the total. However, if you're looking at 7%, maybe you're looking at 5% of the overall value versus the total 7 out.
So if you have a 5-acre piece of property and a home on that piece of property, you're telling me that the 5 acres is not in on it, but the home is? So the home we're gonna value at 50,000, and the land we're going to value at 50,000, make it to 100, obviously. But last year it was 40,000 on the home. This year the home is now valued, am I on the right page?
Yes, when sales come through, we look at a lot of different things. So we're first looking at the sales of just small acres, lots, things to indicate first what the value of the land is at. We don't have a lot of that. We don't have a lot of small acre sales. So some of those things to either increase the land or increase the building is within the sales.
Okay.
So that's why I've chosen to put it on just the buildings. We just didn't have enough to increase land values.
Okay, thank you.
Commissioner Blaine?
Thank you, Mr. Chair. Jean, in all the townships that you listed, every one had an increase basically between 6 and 10%. Other than Pike Creek Township, which was down significantly, is that an anomaly, or how do we explain that?
The last 2 years in Pike Creek has seen an incredible increase. I think the year before was 10%, and then I know it was above, or it was 20% the year before, and last year was about 10. So in the last couple of years, they've seen over a 30% increase in their market value. And so this is just, I think, just bringing that, the sales just came in a little bit lower than what we had on it. We can only use the information of the sales that we have available to us through that time period. So we have to go with what it is. And last year, those sales were up quite a bit. So it's, everybody else seems to be going up at, slower increments. But they went up significant over the last 2 years.
So this would be almost the market correcting itself in that township? Okay, thank you.
Yes, we've seen a little bit of that also in the city of Uppsala. They did go down, not 5% on their building values. They did go down slightly because they too have seen a good size increase.
Thank you. Mr. Wincher?
Thank you, Mr. Chair. Gene, and I know in my area, it keeps going up now, and I want you to clarify for me. In the past, what we have coming due, we have these statements, we got them in January. This is not for that. This would be for the following year, correct?
Correct.
Okay.
What we're gonna be sending, what you received was your estimated,
Right.
your estimated taxes.
Right.
This will be, we will be sending out our valuation notices for the 2020 and what that will be paid in 2021.
And
So
then-
we're always that year ahead.
Right. So a couple questions too. So if I don't like my tax valuation going up, I'm assuming there'll be a time where I can contest it or whatever. And second, if my place is valued at 100,000, it's gonna go up 7,000, doesn't mean my taxes are gonna go up 7%, or if you could explain that or however that may be.
Right. Taxes, I mean, your value can stay the same depending upon what your county and your school district and your township or city levies is gonna indicate more of what that tax is gonna look like. So values can go up, but that doesn't mean taxes go up.
Right.
Values can go down and taxes still can go up, so.
Thank you.
And that was, is there any more questions in regards to that?
I think he had one,
Oh,
first
yeah,
part of his
about
question.
if they could,
Of the
if
local
I can
boards.
contest these taxes,
Okay.
so.
So that was another part of what I wanted to
I'm sorry.
discuss. We're currently looking at the local board of appeal and equalization, and due to the government's recommendation of the social distancing, the Department of Revenue has given us the option to do virtual meetings. Before making any decisions at that point, we were just waiting this week to see what, if any, changes were, because it's moving so rapidly that we really wanted to wait until the end of the week before we have contact with the local board members. So we're looking at potentially doing phone in, where they could either meet as a group or meet in their individual houses, and then have a number to call in where we would discuss what differences, if you wanted to contest your property value, you would just be one of the many on the phone call. It's gonna look a little bit different this year unless things change rapidly. Our first board, we've got open books on April 10th. So that's the start of our local board and appeals. So that, this year could look different. We try our best to take care of things when people call our office. The appraisers, go out, take a look at it, make any changes, maybe make a recommendation to the local board. That again, this year is up in the air as far as how that is gonna be determined. We're gonna try to use, phones, pictures, possibly videos, in order to do that, to keep our staff and the property owners safe.
Mr. Chair?
Yes,
And-
Amy.
And just to further answer your question, the local board of appeal and equalization is where someone, when they receive that valuation notice and they want to discuss that or want to entertain some sort of adjustment to that, that is what we're referring to as the local board of appeal and equalization is held by the township and or the city that property is in. That's their first stop, really, to discuss the valuation that the county has on the property. And that's where they engage the township and or city and our assessing staff to look to see if the township and or city will reconsider that value based on information that property owner brings in, and also the information that the assessor brings forward. So that's the first stop. We are looking at different ways to deliver those meetings, given the circumstances that we have. And we also may get some direction from the governor as far as kicking out the deadline, because we do have a deadline on when those meetings have to be wrapped up. And, that might get kicked out just like income tax deadlines were kicked out. So that might give the townships and cities a little bit more leeway. But that is their board. It is their decision to make. We will be there to help them deliver that, that requirement in any way that we can. And so that remains to be seen, and we'll keep you updated on how we're going to be helping on that front.
And if I may, Mr. Chair, just to let, again, the statement I'm getting here in the next 10 or 20 days or whatever it is, that one is not the one that we would be contesting. It would be the one following that,
Well,
correct?
in your envelope, you're going to get your
Right.
property tax
Yep.
statement that needs to be paid, and then you're also gonna get your valuation notice for the next year. And so it's that valuation notice that we'd be able to visit with you about, either ahead of time before the local Board of Appeal and Equalization or during that. The tax statement that you get is something that should have been addressed the year prior. Yes.
Commissioner Wilson?
Gene, I know in Piers, I think the last couple of years, their property values went up pretty high, if I'm not mistaken, and now you're saying it's gonna go up about another 10%?
Correct.
And that's all because of what things are selling for?
Correct, yes. Pierce City has an extremely strong market. And last year, a lot of the changes that were made last year was because we view property once every 5 years. That was the year that it was up for review. So any changes that hadn't been caught in the last 5 years could have potentially made that value up higher, making that taxes higher as well. But the values did go up because one of the value of revaluing that city. And then secondly, just because the market is that strong.
Very good.
And Mr. Chair, if I could too, this is gonna be one of those areas that we talked about earlier in terms of public communication being very important. And so making sure that we're utilizing different venues or avenues to get out to people in terms of what's happening and whether it be the newspaper, the radio could be a good option or something like that to really explain to people once we do get direction. And Amy's right, all of these agencies at the state in which we are kind of beholden to in many regards are scrambling to figure out what it is that we should be doing and offering direction to us in terms of how is this going to look. And so I think it's prudent to wait a little bit on that. And Amy and I had a discussion, and I know Jean was involved in that too, about what should we do? And I'm like, well, just give it a little bit of time because we have a little bit of time, and I think they're going to need a little bit of time to figure that out because I don't know how it's going to look because it really does put a spin on how we're used to doing business in so many regards, this being one of them, and the timing is such that it's coming up fast.
Mr. Chair, one other thing that I wanted to address with the valuation notices is a couple of months ago, we came to you in regard to the high water situation on Chaminade and Crookneck, and we had told you that we were going to revisit those values outside of the quintile. And just wanted to let you know that that work has been done. And kudos to a couple of our assessing staff who really had a huge workload due to that, but made it happen and met all of their other deadlines. And that was really fostered by Jean's leadership. And so I want to make sure that that does not go unnoticed. And also Jean has some summary on that because that is something that we knew probably would impact the local Board of Appeal and Equalization. And so anticipating that, we wanted to get ahead of that. So I think Jean has a little bit of information on that too, just so you're aware.
Appraiser Brian DeZurek has been monitoring the property conditions on Lake Chaminade and Crookneck. Due to the lack of sales in this area, it's with most of the damage, it's really hard to come up with a value for that. So we've looked at it, we've made adjustments, some of them very strong adjustments. And looking at, with the two lakes this year, we've made about $8 million worth of decrease, just due to either the water that's consuming the land or the damage done to the buildings. Again, we don't have the sales that normally we do have to reduce it. However, looking at some of these areas and the conditions that they're in, they wouldn't have sold for what we had the value on them. Again, it's confusing at sometimes because they're going to look at their tax statement that they receive now and wonder why they're being taxed on this. But the tax statement they're receiving now is going to be for the 2019 assessment, and what that property looked like back then was different than it looks now. And I'm sure it's gonna look different this summer than it did when we looked at it last year. So, we did make a lot of adjustments in that area. But and some properties, you know, when they get their valuation notices, hopefully if they're not one of them, that they do contact our office. And, yeah, and that's important for them to contact our office, just to have a discussion even before setting an appointment for the local boards. Sometimes we can, you know, we can discuss things and see. We don't get into every property, and we do our best to know what that is.
So that is something that we've done ahead of the local boards. So just to, so you know kind of what we've done with the values in that area so far.
And Mr. Chair, and just for that particular area too, especially the LID members, that increased assessment is on there for this year. There was that jump for some of the work that they're doing. And so that will be a message that certainly likely will be discussed with staff, or questions will come to staff regarding that, so.
Do you have anything else, Gene?
Nope.
Okay.
Mr. Chair,
Commissioner Blaine.
I apologize. To that point about the lid assessment, that will be blatantly obvious on a line on that statement that shows that will not be hidden in their total tax assessment number, correct?
Mr. Chair, it is a separate line, but
Yes.
so are school districts. It doesn't mean we don't get calls about it, but it is definitely a separate line, yes.
It's not rolled up in our value in
No.
our tax calculation, no.
No.
So it'll be very clear.
Thank you.
You know, if I made a follow-up on Commissioner Blaine, will that one, because didn't they have the option to pay it off, the whole thing, if they wanted? Is that gonna be on there, or am I missing?
This isn't the project, this
Okay.
is just, well, it's not the big project, it was
Yeah.
and I can't remember the number, and I'm trying to, you don't remember what it is per parcel right now for this year. It was substantially more than it has been because of the increased dollars that was approved in the budget that was there. I can't recall it offhand.
No, I don't recall it either.
But I know Chelsea has mentioned it before, that it's, you know, this is a big step compared to what it was last year, and so continued.
Yeah, because it was for like
Discussion.
150 or 300,000. It's not the $1 million one.
No.
That's correct.
But that one, they still had the option to pay it off fully, I think. didn't they?
No,
think
I don't know
I
that.
don't
I'm not for
know.
sure.
I know that
Yeah.
was discussed, but I don't know if that was put into
Okay.
place for this one or not.
Yeah, I don't-
Good
I can't
question.
remember.
We're still on an annual, this one is an annual assessment for the budget that was there. It's not a amortized project cost or anything like that. So I
Yeah.
think it was just this is this year, this is what's collected.
Very good. Anything else, gentlemen? Thank you, Amy. Thank you, Gene. Amy?
Yep, I just have one more thing for you, and that is to circle back on the Monroe rezone. If you recall, this was heard before the Planning Commission quite some time ago, and due to some information that came up in between the public hearing and that coming before the board, there was some discussion to remand the Monroe rezone request back to the Planning Commission to hold a second public hearing, really in the name of having a full and complete record and for you to consider when you voted. Due to the COVID-19 and our inability to have a public hearing at this point, and then also further complicated with the 60-day rule that we have not been relieved of by the state, this item needs to be acted upon. So what I am recommending at this point is that today that you rescind the requirement or the order for a second public hearing to the Planning Commission, and that you consider the Monroe rezone request on April 7th at your regular meeting. However, with some staff input, and then also with public comment that has come in.
Very good. Gentlemen, could I get a motion and a second for further discussion?
So moved.
Motion made by Commissioner Wincher,
Second.
second by Commissioner Jelinski. Any discussion?
Mr. Chair?
Commissioner Jelinski?
Thank you. If we didn't do this, Amy, what would happen?
The rezone would, if you did not act on this request by April 7th,
Yep.
it would automatically be granted to the applicant without any consideration.
Of anything.
Correct,
Okay.
due to the 60-day rule,
Thank you. That's what I was looking for.
yes.
Commissioner Winter.
Okay, and I had I got a question too, now maybe I missed the boat here. Did we not get an email stating that there's gonna be a planning commission at 8 o'clock that morning? Or is this what we're rescinding? We're not, if you could
Yeah.
explain that.
Yes, thank you for asking. We had 3 items on the planning commission agenda on Monday, and so we chose to really evaluate each one and the urgency, I guess, that it needed to be addressed. With the Monroe one, because there already has been a public hearing, that requirement has been met. And due to not being able to accommodate the public in the way that we would want to for a second hearing, that one can go before the board on the 7th. We also had another agenda item that we were able to extend for an additional 60 days by law, so we have opted to do that for that one. And then the third item was some ordinance amendments, and then to keep those moving along as far as, so they're in place for this coming construction season, and the requirement that a public hearing needs to be held by the planning commission on that. We have opted to have the planning commission hold the public hearing on the ordinance amendments only on Monday morning, the 7th of April. And then you will consider those amendments
That's
at your
8
meeting,
o'clock.
correct?
That's at 8 o'clock.
8 a.m., yes.
Tuesday morning, right before the.
Tuesday morning.
You said Monday, that's
Oh,
what
I'm sorry.
Okay.
Sorry, excuse me, yes.
So there will
Tuesday
be
morning,
there will
the
be a
7th.
meeting at 8 o'clock.
There will be a
that
public
board meeting.
hearing.
Yep, that way you can attend the board meeting, or the public hearing with the
Okay.
planning commission, and then transition quickly to the board meeting then.
Thanks for the clarification.
So what'll be before you for zoning matters on the 7th of April will be the Monroe rezone and the ordinance amendments.
But the planning commission will only be hearing the
Ordinance amendments.
ordinance change.
Yeah,
Yes.
Because
Not
in
the
our.
Monroe, not the Monroe.
No, in
Correct.
our ordinance, it talks about the planning commission, it speaks to the planning commission being that public hearing facilitator.
Yes.
Gentlemen, could I get a motion and a second to rescind the order for a second public hearing to the planning commission for the Monroe rezone request and for the board to take action on the rezone request on April 7th, 2020? Did I have a motion?
I
and a second?
think we did that already.
Motion
Okay.
and second.
We already have a motion and a second. All in favor?
Aye.
Opposed? Motion carried.
All right, thank you. That's all I
Thanks,
have.
staff. Sorry about
Is our
that.
next
Thank you.
planning commission then besides that April 7th on the 27th? Because I've been kind of confused with all these taken off and on.
Yes. So for now, the April 27th meeting has not been postponed. Prior to noticing that meeting to the public, we will have to evaluate that with the Technology Services Department in order for us to ascertain whether or not we can accommodate a public hearing according to state statute. So that will be evaluated before the notices go out, but for now, yes, that is still planned.
April 7th is the only one that's with your office right now.
April 7th.
Planning commission in the morning, I think
Planning,
he's talking.
yeah, Planning Commission, yeah, and Board of Adjustment,
Yep.
it was also supposed to
Yep.
occur on the evening of April 7th, and that has been postponed. So,
And again, to clarify this,
Yeah, I'm confused, that's why.
I did send an email summarizing all of this to you with each meeting date and what that meant for each one of those agenda items. If you'd like me to resend that, that might bring some clarity to it too.
so to clarify, for me, the planning commission, other than the one on the morning, we're also having one on, what other date?
27th of April, which is
Okay.
the
So
regularly
it's not
scheduled.
March 27th, it's April 27th.
Correct.
That's why I was getting,
Yes.
okay, there we
Yes.
go.
All right.
Okay.
Thank you, Amy. Thank you,
Yes,
Jean.
thank you.
Gentlemen, we're gonna take a 5-minute, and we'll start back up at 10:30.
Thank you, ladies.
Thanks, Amy.
You're welcome.
Yeah, now it makes sense.
Board of Adjustments, though, is,
It's canceled. It's canceled.
no, April 7th.
I just got,
Board of Adjustments.
I thought they said that was canceled.
If it's,
I don't know, whatever, we'll get to the bottom.
things like working with Lutheran Social Services. Region 5 has been meeting quarterly at Camp Ripley, and we've got a great number of individuals and community resources that have been working together to better serve, because we've really looked at like the families and some of our National Guard veterans who maybe didn't serve overseas but need a little bit of extra help as well. So I think it'll work really well. So we've been doing that. And also I've been partnering up with public health and meeting with the community health assessment team. And then we were supposed to give a briefing to the drug task force group here, just kind of talking about what, if a veteran falls into that category, how do we work together to help them utilizing the veteran VA services. So a lot of these things, just all of us getting more familiar with the services that we offer so that all of us within the community can help each other. So that's been a big focus the last year. I took my trip out to Washington, D.C. a month ago. That was a great opportunity to see how things really work in Congress. I had never really sat in anything like that in my life before, so that was really neat to see how things actually work from a federal level and be able to talk with individuals and share our ideas and what exactly we want for services, particularly focusing on female veterans, because that population is definitely growing within the VA healthcare system. Because as we see more and more females serving overseas, there's a lot of different healthcare needs that they have, and they're different needs. They're not always going to be the same as what the males were, or if they're suffering from military sexual trauma or something like that. Do you want them to be the only female in a group of mental health type things or something like that? So just relooking that and how can we better serve those individuals? And also getting them to utilize the VA services more and making it more effective. And then because of our partnering with a lot of different entities throughout the county and throughout Region 5, we've helped over 30 families over the holiday season. That was kind of a way back, but it was really cool to be able to provide better living styles and better Christmases for a lot of people. So looking back, way back on the holidays, but it was really cool. It was more than we've ever helped in the past, so very neat. And then I wanted to capture, we had about a month ago, we had a really cool good news story, because we got so many things that we focus on that are horrible probably lately, but one thing that was really, really neat, there was a story of a widow who had lost her husband. He had passed away of an Agent Orange condition, and he had a claim that was pending and while he passed away. And what happened is she was able to get back pay for benefits and get benefits for the rest of her life, because we had filed a claim way in the past. And this lady who had nothing her whole life got $321,000 of back pay. So she's living a completely different lifestyle. Very, very cool. I don't think she'll know what to do with that or spend that, but I mean, it was just something that was very neat. And within that same week, there was another person from the Navy Blue Water claims that got $89,000, and then another one with $40,000, and another. So basically, over a week's span, we had $471,000 of back pay. That was very successful claims. So that was a cool, good news story to help our Morrison County individuals, and it was really neat because each family that got that was people that really, really needed it. So how often does that happen? Then, looking at the last few months, what have we, how many people do we see? You can just kind of see most of our people are email, phone calls, and that's definitely growing now. That's our only way of business right now, is just by working phone, email. So our in-person working with people is definitely changing. A lot of correspondence stuff. When I say that, that's just things that are sent to us via email, or maybe we're just processing paperwork that we had throughout that day. So that's just kind of where we're at with how we work with people. I have a huge email distribution list that I have built, and it keeps on growing and expanding, and that's been a nice way to work with people, and it kind of saves from having so many people come in to see us, because a lot of times we can just field questions that way. So, and it also gets information out to people quickly. And people seem to really appreciate that and like that, so that's been good. And then just looking at what kinds of things are we working with primarily, and mostly we work with service-connected compensation. So if someone's hurt in service and they're still having issues today, they have to have that correlation. They can't just say, well, my back hurts, it must have been service. There has to be proof. There's a lot of things in building a case for that they actually have to have evidence that something happened in service to get VA compensation. It just isn't an automatic thing. And that's probably our primarily what we work with, but we also connect people with healthcare. We do a lot of things with education, finding people financial help if they need it, mental health. There's a lot of things with that, and I think that's gonna grow as things get more stressful, people get stressed, so that will definitely be a bigger group of population that we work with. Also probably the financial piece. We work with education benefits, and that's kind of up in the air with some people too now as their education benefits and they're taking online courses and stuff. There's gonna be a little bit of struggles with some of the colleges in that area too. So we're definitely seeing a little amped up of lots of questions. What's gonna happen if this happens and those kinds of things. But that's where we are. And then just, I think we captured kind of the good news stories. How are we running business? How are things going right now with the changes? We've been actually fairly busy. I think a lot of it's just a lot of questions. We've been fielding questions through the phone, via email. Those are the things that have been pretty big. We have a lot of people with financial hardships. Those don't go away. This time of year, we see a lot more deaths just because it's after the holidays. I don't know, in the winter, it just seems to be the trend since I've been here. So we see a lot of processing burial claims, that kind of thing. And then we have people that are in financial hardship, so trying to connect the widows to the benefits that they need. So that's been keeping us fairly busy. We've been doing, one thing that is nice is we normally had to have people come in and sign all of their claims. No matter what it was, we needed the original signature. The VA higher headquarters is allowing us now to do electronic signatures or just doing things via email. They can scan their claims and send them to us, so that's really cool. Maybe we'll do that in the future. That would be awesome. That would save a lot of people trips to coming and seeing us. So that's been keeping us going, really, and that's a good thing. Because we don't want to be just sitting around twiddling our thumbs. And so far that hasn't happened. I don't know. There might be days where it is, but so far we've been all right. But that's where we are. But of course, if other people need help, we're always willing to do whatever we need to so we can all help each other as well. But that's kind of where we are. Are there questions with the update at all?
Gentlemen?
Thank you very much.
Yeah, thanks for that.
I like it when you send in, you got an email, somebody needing help, driver for this or that. I like that when you send that out once in a while for people that need stuff.
We have, sometimes people just retire out of the military and they're looking for a way to help people. And so it works nice. Veterans helping veterans. It's a cool concept. Then my next, go ahead.
Yeah, I was gonna say, thank you for that.
Yeah,
Move
you're
on to your resolution.
So the next thing that we have is Region 5. So we have our counties that get together. Last year we had a program. It was a food program through Sprout. Each county had 10 families that they would help out. They meet at Sprout, they get a package of homegrown food, and then they learn how to prepare it. And some counties that was bigger than others. Ours wasn't too bad. I think Wadena County probably utilized the program more than anybody. But our participants would like that program to continue. So the only way that we can do that is to go and ask for Sourcewell funding. We may or may not get that, but what this resolution is just for us to be able to go and ask for funding for that. The things that they're gonna add within that program to make it a little bit better and enhance it this year is incorporating mental health wellness. So learning a little bit about meditation, yoga, how to deal with stress, and also just eating healthy and all those things that kind of bring people together to living a better life. And so what they're asking for is $66,355, but that will be Region 5. It doesn't impact us at all. If we get it, we get it. If we don't have a program.
I'll move on this, Mr. Chair.
I have Commissioner Jelinski.
Second.
Second by Commissioner Winter. Any discussion?
Mr. Chair, I would just for further discussion, if I may, thank you. Kathy, I'm very clear what you said, but I just want to make sure that we're all on the right page. In order for this to happen, the funding would have to come through Region 5, through Sourcewell.
Right.
If it doesn't, it just doesn't happen.
Correct.
As of right now, for the funding.
Yeah, unless there's something else that way they come up with.
Very good, thank you.
Any further discussion? All in favor?
Aye.
Opposed? Motion carried. Thank you, Kathy.
Thank you, Kathy.
Thank you very much, Kathy.
Healthy, everybody.
And I didn't say, but thank you about the flags upstairs. They look wonderful. I love them.
Oh, yeah, thank you guys for letting us do that.
Next on the agenda, Public Works. Good morning, Steve.
Morning, Steve.
Morning, Mr. Chairman, members of the board.
Hi, Steve. Don't get creeped out when we're sitting behind you.
As long as you don't jump. Well, we are continuing to try to put together and, sorry, I have to do that. Put together and maintain our road program for 2020. Definitely have some concerns on revenue, especially the sales tax. With what's going on, I think there might be, a little bit of jump on some things, but the things that really drive our sales tax, the purchase of equipment and tools and all of that type of stuff, I'm anticipating is gonna take a plunge. So we've done some rebalancing between the revenue sources that we have, which are federal revenues for construction. Our CASA 34 project, which we're under construction, is federal. I don't expect we're gonna see anything happen with that's gonna come through the way it's supposed to. State aid allotments, the way those work, they begin collecting state aid revenues from tab fees and gas tax going into the trust fund from January. The allotment notice that we get in January of 2020 began collecting in July of 2019. So you have 6 months of the previous year, and then they project 6 months of the existing year. So we have about 4 months that they're not really sure how much is going to be generated, but the trust fund was healthy, and the conversations I've had through MnDOT is that we wouldn't expect any change in our 2020 allotments, but 2021, obviously, we'll have to see where they come out. So then the two other revenue sources we have is the property tax levy and then our sales tax. I'm anticipating, I'm going after this at cutting our sales tax in half for now. That'll, if it generates higher revenues than that, it'll go into the fund and we'll be able to catch up on those projects in the future. And so what we're proposing here today for the board, and I think we're fortunate that we had early lettings. We were under contract on most of our program. This recommendation today here will be the biggest contract that's left. We have a couple of small ones for safety, painting, and that type of thing coming up in the future, but they're going to be relatively small. So I think that for 2020, we should be fine to continue forward. We want to support the economy, make sure there's work out there, that type of thing as best we can. We have not, it's not like we have not been exposed to situations where our road program has had to stop during construction. When the federal government shut down, we had to shut down those projects. We have some experience with that if this got to that point. So I think it's prudent for us to continue to move forward, and these recommendations today are based on that assumption. So the first one is with Parker Township. This is a town bridge account project. Currently, it's a structure that is not a qualifying bridge, but the hydraulic analysis that we've gone through shows that the replacement structure is a qualifying bridge replacement. We've been kind of dealing with them for a number of months because they have had a property owner that they weren't quite sure how he was going to react to the project. They resolved those issues, and so that's in place. They entered into the agreement for us to move this project forward. I'm not sure if it happens. I'm not sure if we'll be able to put it all together and get it to happen, but if it happens, it'll be a late fall project for them out there. And so our request is that the board would authorize the agreement that we have in your packet and direct the board chairman and the administrator to execute the agreement so we can do this work for the township.
Could I get a motion and a second?
So moved, Mr. Chair.
Motion made by Commissioner Blaine,
Second.
second by Commissioner Wincher. Any discussion? All in favor?
Aye.
Opposed? Motion carried.
Thank you, Mr. Chair. Mr. Chairman, members of the board, then this is the larger state aid contract along with County Road 283, this project that we've been working on in Genola. On the screen, nope, this is where we want to start. If you would. Yep. These are all, we combined these all because they have somewhat similar activities. They're earth moving and they're pipe work. So there are two bridges, the red mark and the green mark are two existing bridges that we're proposing to replace as we prepare CSAH 21 for future pavement rehabilitation. The entire length of 21 is highlighted because we have a number of small centerline pipes that we would also be replacing under that contract. And so the abstract of bid for those projects were included in the packet. Then 283 should be the next slide. Yeah. Then also this, by the livestock barn in Genola, connecting Trunk Highway 27 to 25. This is a local project funded by, that we'll be funding with property tax. We combined that with this contract. It was a little concerning that we only received one bid. I think part of the reason for that is the timing and what was going on. We had a number of contractors that had shown interest in it, but and had proposals and plans, but did not submit bids. There's quite a bit of work on the docket that's coming up for some of those contractors, and they were not quite as situated as well as the contractor that bid here. You take a Landwehr, a Midwest, they're kind of more south of us. Some of the smaller contractors, they may have difficulty bonding or that type of thing where they can do a small single culvert replacement or bridge replacement, but when you get into something that's $1.5 million, it becomes difficult for them to bond for it and then bid. We tie them together because we need to in order to manage our staff and be able to cover the work. In looking at our estimate, the engineer's estimate, one of the reasons that we do that, these projects come within what the engineer what we would have anticipated them to come in at. So the bid is a reasonable bid. Marvin Treader is the lowest, Incorporated is the lowest responsible bid. Our recommendation is that the board would award this project to him. And that's my request. I'll make a motion on that, Mike.
Motion made by Commissioner Wilson,
Second.
second by Commissioner Blaine to approve these projects. Any discussion? Oh, yeah, you just told me that too. This will be a roll call. Commissioner Jelinski?
Aye.
Commissioner Blaine?
Aye.
Commissioner Wilson?
Aye.
Myself, aye. Commissioner Wincher?
Aye.
Motion carried.
Mr. Chairman, members of the board, request for board action number 3 is a project that we are assisting administration on. The design of the replacement of the parking lot here at the government center was designed by Winsor Smith and Knowlting. The administrator asked that we help support the bidding process and potentially the future construction, staking, and inspection to help, I think, reduce some of those costs, which we are going to do, and I think we're going to make that work. We advertised and solicited proposals, and those proposals, the abstract of bid for those proposals are included in your packet. And then I think Deb would want to respond to the funding and how that would be done.
Deb?
I do just want to clarify that I did ask nice. Once I asked nice for one. Yes, so the building project, that was a directive, or it was direction that you provided in terms of there are some bond proceed dollars, and when we looked at what we had still on the list to address, our coming up needs that we'd have for the organization, you wanted us to take a look at where we were sitting, and the parking lot, in the age of the parking lot and the condition of the parking lot was one of those on that list. And so that's how we got to where we are in terms of taking a look at that replacement and see once if the numbers can come in such that it fits within that plan that we have and those dollars that are available. And this does. We were estimating a bit higher than what the bid has come in, so that's good. It didn't go the other way. And so this is work that we're going to continue to recommend we move forward on and get the work done and have it complete. And we are still working out details in terms of helping with the management of that. It's a busy construction season. We're going to work with, between WSN and with Steve's help, work with trying to figure out how we can manage that as low a cost as possible. But that still could be added to this. Just know that that is still being kind of detailed out and worked out. But I do appreciate Public Works in terms of being able to help advance it thus far and help me know what it is we need to do to be able to manage that. So I do appreciate that. So we are recommending moving forward and accepting that lowest bid at this time. to
I'll
set
make a
that
motion for
forward.
more discussion.
Motion made by Commissioner Winter,
I'll second it.
second by Commissioner Jelinski for further discussion.
So Steve, we estimated it at 522, is that correct?
The estimate, since the plan was designed by WSN, the estimate was from WSN.
Yeah.
That was not, that was their, it wasn't by Public Works, but that was what they estimated.
Okay, and then we're coming in at 327, is it?
Yes.
Does that include like the handicap and all that
Yes.
sort? It is,
Yes.
so, does that also include us basically busting out, I mean, it's everything, there's no hidden fees, Steve, on this one, so.
Well,
as-
if they run into something that is different than what the plan shows, and we have to make a change.
Understandable.
That type of thing. Is-
Okay.
Otherwise, yeah, the existing sidewalks are coming out, you're gonna move
Okay.
the access, curb and gutter, all those type of things are gonna be replaced. It's all gonna be ADA
Okay.
compliant. And then the new pavement and that's the complete.
Appreciate that information.
Commissioner Blaine.
Steve, thank you, Mr. Chair. Steve, that 327, does this include the engineering oversight that we had talked about in the past? That was something that, my last remembrance was we were going to seek out some help to try and have that addressed. Is that number a part of that 327?
No, Mr. Chair, I just mentioned that that would be an additional, and we're working with Steve and WSN to determine exactly how that looks as the construction season advances and availability is determined on what we're doing.
We've been looking at our work and how we can make this work, and I will commit that we're gonna do the most of the construction staking and inspection for this project, and we may have to bring some support from WSN, but it's gonna be minor.
He just said that publicly, so.
And Deb and I, with what's going on, haven't had a chance to really
Yes.
discuss that well, but
Yep.
that's what I was gonna tell her.
Okay, perfect. Good news. Nice.
Commissioner Jelinski. Oh, I'm sorry. Go ahead, Commissioner Blaine.
No, I just wanted to make sure that there was clarity that the number that that was just exposed at 327 did not include that engineering oversight to make sure that we're ADA compliant and that this is done according to spec. And so that number will be forthcoming as far as what that cost will be.
When you looked at, I mean, we did have an estimate from WSN, but that's one of the reasons why I think Deb asked for our support with that. Compared to the west parking lot, which we did with our own forces, this was substantially less. And the same thing will happen here. We typically will bill our cost, what it cost us. We don't mark it up, we don't change it. It's what it's costed the department to do it for the general fund. I'd expect we'd be able to cut what that estimate is in by at least a half.
Commissioner Jelinski.
Thank you, Mr. Chair. Steve addressed it, I'm confident of it. Commissioner Blaine just did. I just want to be crystal clear on it. When this job is done, the parking lot will be as ADA compliant can be.
Boy, that's a tough.
It's a big one, but that's part of the game.
One of the things that happens with that, Commissioner, is
we'll build that to ADA compliance, and at that point in time, it is as compliant as it could be. And a year later, there will be issues that make things, certain things, out of compliance.
Absolutely, but today it will be.
When we build it, we will build it according to what is required to meet ADA compliance at the time.
And that is all that I can ask, and I appreciate that. Thank you very much.
Any other questions? Roll call? This will be a roll call, gentlemen. Commissioner Blaine?
Aye.
Commissioner Wilson?
Aye.
Myself, aye. Commissioner Winter?
Aye.
Commissioner Jelinski?
Aye.
Motion carried.
Thank you, Mr. Chairman. Mr.
Thank you.
Chairman, members of the board, we had a late RBA go into the packets on a easement that we need for the landfill cell 6 construction that we're under contract with out at the landfill. We've been working with Crow Wing Power on providing power to the pumping system that'll be utilized to pull leachate out of landfill cell 6. And in that evaluation, we believe that it is the best situation to extend our service now instead of trying to extend the current service that we have. We'll create a new service that will serve landfill 6, 7, and 8. The future, we're going to be on those. We're going to need to have something done so that we can provide enough power for those future cells in this expansion. So we believe this is the right time to do the additional service at the site. And so we're going to take off from the service where it ends now, and it'll be an overhead line that we carry along the east side of the cells and utilize then that new service to provide electricity to the manhole that'll go in to serve cell 6. In order to do that, Crow Wing Power requires an easement and then also the expense of paying for the extension. And so that was included in your packet. We are asking that the board would authorize this easement and then authorize the expenditure so that we can pay them and we want to get this put in place so that once the cell is constructed, it's in place and we don't have a delay with providing power.
Gentlemen, can I get a motion, a second?
So moved, Mr. Chair.
Motion made by Commissioner Blaine,
I'll second it.
second by Commissioner Jelinski. Discussion?
Mr. Chair,
Commissioner Jelinski.
if I may, and thank you. This would be an increase to the whole project, Steve, if I'm on the right page, of almost 13,000, and that would come out of
We are, Mr. Chairman,
what?
Commissioner, we had anticipated we had to provide power. I mean, we knew that. And that was in the $1.5 million. And the project that came in that's under contract is at 1.3. So we are within what we anticipated.
Perfect. Thank you. Thank you, Mr. Chair.
Absolutely. Any other discussion? This is a roll call?
Yes.
Gentlemen, this will be a roll call. Commissioner Wilson?
Aye.
Myself, aye. Commissioner Winter?
Aye.
Commissioner Jelinski?
Aye.
Commissioner Blaine? Motion carried.
That's all I have, Mr. Chairman.
Thank you so much, Steve.
Thank you, Steve.
folks.
Take care.
Thank you.
We did have a roll call.
Yeah.
Didn't need to be that?
No.
Okay.
We're going
Because it was
to,
in your district. No, just kidding.
Order, Mike.
Mr. Chair, I'm going to mess with the order a little bit if you don't mind, if you would.
No, I'm fine with
Wouldn't
it.
mind. First, there is an RBA in the packet for extension, just
Thank
the
you.
report for you to go over. They're not sending a staff in for that, which is totally understandable and
perfect.
fine. So you can peruse that at your leisure. And then I also have Amy Middendorf coming down to talk a little bit about board meetings, but thought we would start with Mike because he's sitting there nicely
Morning,
at the
Mike.
table already.
Good morning,
Pardon me.
all my friends. That's right. I've brought the updated budget and handed out. As you can see, we're getting down there. We started the last phase of construction now in the sheriff's office with the demo work. So Contingency, we're sitting at 85,000 or just a little bit more than 85,000 at this point. So we do have probably 40% of the demo done in the sheriff's office at this point. We haven't gotten into license area and drug task force and some of the Sallyport areas like that, but so we have opened up a bunch of it at this point. So I don't know if there's any questions on the budget.
Any questions, gentlemen?
Nope. Other than that, 60s building, the upper level, we're installing ceiling tiles right now and doing some work in the data room upstairs in the 60s building. We're going to start carpet down there later this week. Thursday is what's scheduled. On the main level, we're installing lighting, sprinkler heads, and some diffusers for duct. And then the carpet there is scheduled to start mid-next week. So.
Very good.
Right now, we have furniture scheduled for the 6th to be installed down there.
Great.
And Mr. Chair, in terms of the building as a whole, it's been, as things have evolved the last couple of weeks, it's kind of a, blessing in disguise how we've advanced the work that we've had and the ability to be able to kind of separate public and employees, has a security component. And we think often of the physical threats that come with that, but clearly, our mind's expanding, and it's not just, it's that the rest of what we have going on too. And just being able to close things off in a way that allowed access last week and earlier this week for courts that required a door to be open, but yet county offices were closed, and working with them, and that's evolved since then too, about having public contact. But as we've done that, I've been appreciative of the setup that we have moved to, and the ability to be able to have some of that separation and have counters that are less open and have some different arrangements that are made. So, it's just kind of been one less thing that we've had to navigate because it's been set up well. And I think it's been noticed, I guess, in terms of the good work that was done to really get this building set up in a way that works for a number of reasons. So thanks.
Commissioner Blaine?
Mike, the COVID issue has not affected what you've been able to do here with this project?
Well, we have a protocol in place that we put out to all the contractors here on the job site. The biggest thing we've noticed, or that I've noticed, is, instead of having 4 guys working in an area, where now you're kind of down to 2 because you have to keep separation. And just going forward, that's going to be probably the biggest thing to keep an eye on, down on that end. We're working on a number of different things, but, everybody's kind of working separately. This guy's working here, this guy here, this guy here. And so that's the one thing that's changed, where typically you could say, if the tinner and a sprinkler guy want to get into a certain room along with an electrician, where if it's big enough, safety-wise, they can get in there and work together, where now you're not able to do that. And part of that is, like this last weekend, I had 2 different contractors come in and work over the weekend. And that just kind of so they could get their time in that building and not have to be there, because then it takes away somebody else from being in there, I guess. So that's kind of been the impact that I've seen so far. So other than that, that's been about it at this point.
So you don't look at this health issue as we speak right now as delaying progress with the project?
Just going forward, that's something we're gonna have to keep in mind, as far as where we would have more people in place, we're having to do with less people in place. And so how that's gonna affect it, I don't know at this point, but that's some of the ripple effect. We have felt a little bit of that. Like I said, we had some guys come in over the weekend to work on different items just because of that. So they could have their time in that space, because otherwise, with an electrician and a tinner and that, you couldn't fit all of them in the same area.
So if I may, Mr. Chair, one question I thought about in this and with the task that, that you're up against here, working with this, What would happen if a contractor who's already been awarded a contract to work on it as part of this project, would lose manpower within their organization because of this pandemic issue, and that would, and then they would not be able to, let's say, come in and work on this project in whatever timeframe. Do we have a plan on how we address that, or how, I shouldn't say we, but I mean, obviously you're the boss and you have to handle all that, but do you take those things into consideration with the dynamics that we have now, or have to?
Yeah, I mean, we've had discussions on it, and contractually, that's something I would have to look up, you know, on something like that, so that I wouldn't be able to answer, but we have had discussions on it. I know that some projects are starting to see, I shouldn't say that starting to see, but I've heard materials will be slower coming for different things because of production is shut down, whether it's here or there type of a thing on what it is. That hasn't affected us here at this point, just because a lot of our materials are here already. So I don't know how that would affect us in the future either. So, I mean, but we have discussed it, so.
Good, good. Thank you.
Anything else, gentlemen? Thanks, Mike.
Good job, thanks, Mike.
And we do have a construction meeting following this to give you some updates on what's happening.
Okay.
Amy is on her way down right now, but one of the things I wanted to touch base on what we're going to talk about is a little bit, is involved in that public meeting, the 13D, and how you can conduct meetings, and the fact that if you are ill, please don't come here, and let me know, and we can set up an electronic way for you to participate, whether that be by phone or what Amy is going to talk about as soon as she gets here. My guess is she had an emergency she was dealing with, but live streaming and what that means and how that looks, so you guys can have an understanding about how we would suggest at this point in time you conduct those meetings and still be visible and transparent and accessible to the public. There hasn't been exact direction coming from the state on any type of public meeting guidance or deviation from the rules and regs that we have to follow. However, I hope that's forthcoming, like similar to what Amy was saying when it comes to some of those land use laws. And many areas of this building has different regulatory requirements that they need to follow in without getting direct guidance from the agencies or the governor's office that require us to follow those. We're kind of trying to comply as current law allows, but knowing that there'll be difficulty. And so Amy was looking into some solutions on what live streaming would look like and how that would be implemented and how it would be interactive if we need to conduct a public hearing in that. And so I'm gonna let you talk about it. How's that?
All right, I don't know where my notes
Morning,
are right
Amy.
at the moment, but
Morning,
good
Amy.
morning. It's been kind of a crazy morning. So I talked to the company that implemented the system in the boardroom here. So if you guys want to do the live streaming option for public hearings, he can come out this week. And I don't know how much in depth you want me to get with it, like the actual setup or how it would work, but what would you like me
What
to
would
do?
it look like to the public? How would it look to the board? What kind of the
So
process?
for the board and the meeting itself, nothing would change. You guys would still present, sit here, use the microphones. Mark can still record and do all of his things. What it would be is we would add an additional piece of hardware to that back room. And then that additional piece of hardware would connect to our YouTube channel that Morrison County has, and we would use the YouTube live streaming option. And then we would have to communicate out to the public the link that they would have to click on to watch the live stream. So right now, we post our county board meetings to YouTube after the meeting. This would just make it available to them to watch while we're conducting the meeting instead of after.
Amy, if I may, Mr. Chair, again, this is a public meeting. But do we abide by the rules of the no more than 10 in a room or 10 in a crowd? You know, you know what I'm saying? Is that part of that? And then the second thing is Deb brought up, and maybe either one of you can answer the question. And I know that the state or the federal legislators or the federal senators cannot have a vote unless they're present. I don't know, does that apply to as county commissioners throughout the whole thing? So if we do call in sick and you're here for voice streaming or however technical, which is over my head, those are questions I would have, you know?
The second part of your question first is the component, and I don't have the statute right in front of me, and I wish I would have, but the 13.D.
.021.
021,
Yep, it's 021.
talks about your capability or our capability as a public entity to be able to govern with technology included in it. And so that addresses the fact that somebody has to be able to be present here at the location, and the fact that you can call in and that you can have interaction like that and still vote, still conduct business accordingly. So that's what that section of that declaration did. The other component, when you talked about the 10 people, the limitation on that, like this morning, we have a large room and we're able to spread people out. But a public hearing, we want comment, we want that invitation to be able to come and interact with us, but you can't physically come and interact with us now. And that's the question, or that's the component that Amy's talking about with implementing some technology, that we can provide direction on how you're able to interact with us using electronic means instead of physically coming here and potentially not adhering to what it is that you identified, which is more than appropriate number of people in the room and crowding in. And so we want to be able to provide that, if you'd like, to be able to conduct some of those items of business that we know are going to be coming up and not just come to a complete halt.
And in regards to you guys being here, I have that open meeting law provision pulled up here. It says at least one member of the public body is supposed to be present at the meeting location unless unfeasible due to the health pandemic. And then all votes would need to be taken by roll call.
So you're saying that statute says we don't have to be here, but except for one,
Unless everybody's, like, can't show up.
And then you can just do it.
Then we
by
could do it all
the
via
audio.
a video.
So the question I have, so if one of our chairs here, the rest of us four don't have to vote because we're not here?
Yes, you have to vote. It just indicated that it would be just a different process. So I'll be a roll call so we can make sure we acknowledge where everybody is at for that vote.
So we would have another means, so we'd have the live streaming option for the public, but for you guys, we would create like a teleconferencing, like a video call almost. And then that's what the public would see, is what I envision. If you've done like WebExes or Zoom meetings and things like that, is you guys would do like a Zoom or a WebEx meeting, and then we would stream that to the public.
So you're saying it doesn't, go ahead.
No. So we would just hear the people on like a phone call.
You would not hear the public side. You would just hear, that's how I
The
understand.
public wouldn't be able to ask us questions?
I think when we would conduct, or if we would conduct a public hearing, we would have to have a couple of different components. That live, YouTube Live has the ability to submit comments, I think electronically, like a typing in comments. But I think we would also need to, in concert with that, create some type of telephone call-in arrangement that would work to be able to talk through and submit comments. That's what I'm picturing, that there may be a combination of different technology tools depending upon the meeting and depending upon the need that we have with interacting with the public.
But an audio or a email.
Yep.
So, Mr.
Yes.
Chair?
Commissioner Jelinski.
Then in that case, if I'm hearing it correctly, for instance, we would have to have someone like an Amy that would be running that portion of it. Oh, I see there's a question from Mary, and Mary says, how's the weather today? And then we would discuss how's the weather today, as as a broad example of something.
Yeah.
But that would go through that third person being you,
Correct.
as an example.
Correct. And in my head, if we needed to do the public hearing piece where you need the actual interaction, we would just have to maybe adjust the agenda. So we're going to talk about these things, and now we'll take questions, and then you say, hey, Amy, what do you got for questions? Let's go through them, type of thing. And if there's something urgent, I can poke whoever. And say,
And we
"Hey,
can get phone numbers, and we can call these people, and we can have them on speakerphone, and we can, I don't have all the details worked out yet on exactly how that would look, or what technology we deploy in conjunction with this YouTube Live. There is a cost to that I just wanted to get your thoughts on kind of how it works in general, and working towards getting a solution for you with details to come on exactly how that
Well,
would
with
work.
that being said, you probably hit one of the things that the board probably is thinking and not saying. What kind of cost are we talking about?
Let me pull up my notes here. So the option that I'm looking at is gonna be around or less than $1,500.
Total per meeting, per something?
Total to set up.
Yeah.
Because
that's
we
something
are, will recycle equipment that we have here, a piece of hardware, like a
Yep.
computer, that we have here. So really, we're paying for the company to come in and set it up, show us how to use it, and get it working with all of this.
So for 2,000, to not to exceed 2,000, as an example only, not to exceed $2,000, we can have this all take place
Correct.
time after time after time.
In theory, yep, provided it all works well, but yes, exactly. And this is one of those that under that declaration is a type of, or an example of an expense that would be there. Given it's your meetings, given it's your public interaction, I wanted to just talk about how this would work so you're aware of it, and so that we're thinking about trying to find a solution. This stuff doesn't happen overnight, and there's been a lot of things that we've been talking about, and so I just wanted to let you know what we're working towards, and if you have a major objection or a different thought on how you'd like to see that work, we wanted to know just because we happen to be able to visit with you today about
So
it.
today is to get our approval to bring it forward in the future, or just to move forward with it?
To move it forward with it.
I'm all right with you moving forward with this.
Yeah, I'm online too. Do you need a motion?
Do you need a
Well, as
motion?
long as you're here and doing that, sure.
Okay.
But again, just a good example of something that if this was last week, I wouldn't have you in front of me, and I'd want to be able to
Yes.
take and move forward with something. So, yeah.
Gentlemen, what do you think?
I'll make that motion to.
Motion made by Commissioner Wilson.
Mr. Chair, I'll second it for discussion.
Second by Commissioner Jelinski for further discussion.
I would like to have a caveat somewhere, not to exceed
Sure.
something. I think that's fair, at least what I heard, because what I heard from Amy was 1,500, and I'm smart enough to know that, trust me, it's gonna be 1,501, or it's gonna be 1,795. So I would ask that maybe a motion such as Commissioner Wilson made to have a not to exceed maybe 2,000.
Okay, but knowing that if it, yep, that works, that's fine.
Well,
It should be.
Yep,
is
should
it
be
gonna be
fine.
10,000?
No.
No,
That's my point.
Sure.
Commissioner Wilson.
I guess the point is, if this was a week earlier, Deb would have had the authority to go ahead and do this without that.
Yep, or a week later, or whatever it might be, or 2 days,
That's
so,
not what we're doing.
yep.
That's not where we are right now.
Commissioner Blaine.
Thank you, Mr. Chair. Amy, you referenced the rights that we have and how we conduct business as a board was referenced in statute. Can you tell me where that is in statute? And if this was something that was just changed in law because of the pandemic, or is this something that's been standing?
Oh, it's something that's been standing in terms of how to conduct meetings if you are unable to be on site. That's always been there. It's just highlighting that because we don't typically use it, or we wouldn't need to, but given the situation as being more prevalent, or possibly more prevalent,
Yeah.
it would exist.
So
There
this-
wasn't a change to that law.
The statute is section 13D.021, subdivision 1.
13D,
.021, subdivision 1. So yeah, it's always been there, it's just they're highlighting it so people understand it a little bit better.
And there might be other, other like regulatory leeway that comes down that might exist that's different than this. We haven't seen anything yet, but that's kind of what's coming from different agencies, or the governor himself directing, you know what, given this circumstance, even this is hard to do, or whatever it might be. But as of now, it exists like it always has.
And if
Commissioner
you'd like,
Wilson.
I can email that information to you. It just lays out the statute real clean.
Thank you. I
Commissioner
appreciate that.
I'll change my motion to put down as
That's fine.
$2,000 max. or whatever.
Maximum. Okay. Any other discussion, gentlemen? Is this a roll call?
Yeah.
This would be a roll call, gentlemen. Myself, aye. Commissioner Wincher? Commissioner Jelinski?
Aye.
Commissioner Blaine? Commissioner Wilson? Motion carried.
Thank you.
This is something we'll have, I mean, hypothetically, through
Yep.
infinity if we ever need it in the future.
It just hasn't been
Next year
high on
when
the
the
priority list
comes
because we've
back
been able to
again.
accomplish it otherwise.
Thank you, Amy.
Thank you, guys.
Thanks, Amy.
Thanks, Amy.
Deb?
Anything else from me, gentlemen?
Not for me anyways,
All right.
gentlemen.
Schedules, Tabitha?
What's that to
Where
us?
are we at for our schedules, Tabitha?
It was sent to us. Trust me.
Okay.
Commissioner Wilson?
Okay, on the 31st, I've got planning session, 8:30. On the 3rd, I've got TSWAC. Board meeting on the 7th. Or that one's at 8 o'clock now, right?
Yeah, there's a meeting prior
Prior to that, yeah, at 8 o'clock. I don't know if you want to list those separately.
I got that email on Sunday.
I've got annual meeting on the 8th. I think that was with the Tri-County.
Yes.
That's
But I-
canceled.
Got canceled?
Canceled.
Yep.
Okay. And how far do you want me to go?
through the 11th.
Okay, that's it for me then.
Commissioner Blaine?
I'm good.
Commissioner Jelinski?
I think the only thing that I'm going to add today is going to be trails on the 9th, and that's going to be up in Baxter.
Commissioner Wincher?
Did you bring up the TSWAC? Did you say
Yep.
that? Oh, okay.
On the
Yeah.
3rd?
This
The
next
3rd.
Friday.
Third.
The 3rd. And that's at the landfill. Just want to
Yes.
verify.
Okay.
That's good.
Otherwise, yeah, if everything, nothing else cancels, we should be okay. I'm good.
I'm good. And the 7th was, there was an 8 o'clock planning commission on the
Right.
7th, right?
On the 7th, right, at 8 o'clock, yep. Well, no, that was planning as in.
That's that,
Yeah,
Planning commission.
planning
right?
commission will be here at
Yep.
8 o'clock, and then we can have the board meeting afterwards.
Yep.
And BO Board of Adjustments canceled that
So
day.
bring your wet wipes to clean your spot off.
They're damn straight.
Got her.
Wear a mask, I'll bring them.
Anything else, gentlemen? Could I get a motion and second to adjourn?
So moved.
Second.
Motion by Commissioner Wincher, second by Commissioner Jelinski to adjourn. Any discussion? All in favor?
Aye.
Opposed? Meeting adjourned.